Hi class, hi professor, this is Victoria Vasco and I am presenting my final case. I apologize for the mask. My internet went down in my house, so I'm at my friend's house using her internet, and the requirement was I wear a mask because she has two young kids. So welcome to 2020. On this particular case, this wasn't actually a patient I took care of during this term. It was one that I took care of at my last term, but I found it very interesting and I kind of wanted to use it as a possible public health announcement because her diagnosis set close to home and made me realize some things, including the consequences of our basic upkeep and beauty needs. So this lady, she is a 56-year-old Asian female. She presented to the clinic today with a complaint of a dark line that appeared to be brown, almost black, that ran vertically from the base of her left fourth finger up to the tip. She was actually told to come in by her nail person. Her biggest complaint was she used to be able to do a French manicure, and now this line shows through the French manicure, and she's been having to do darker colors to cover it up. She's a lawyer, she's a professional, and she admits to doing gel manicures 2 times a month for at least 10 plus years religiously. She admits that she has not looked at her nail beds. She goes in, she gets the polish taken off, and she gets a no coat put on, and she literally has not seen her nail beds for at least 10 plus years until she had a manicurist tell her that she should probably get this checked out. So this patient's general appearance is she's well nourished, she's well dressed, no real major medical problems. She does have hypothyroidism, which she takes Synthroid for. She takes Protonix for a little bit of GERD, and she has some lifelong basic anxiety and depression issues in which she takes Wellbutrin 100 milligrams. At the time of evaluation, her finger was pain-free. She denies trauma. There's no other fingers that have any kind of discoloration. It's just the left fourth finger that has this vertical line that's discolored. I actually took, this is a photo of her finger, but I wanted to upload a photo to show you exactly what it looked like. This is a thumb, but it was on her left fourth finger, and this is identical to what she came in complaining of. Like I said, it was pain-free. She does admit to having some pain only when she puts it under the UV lights. At that time, it's a short, intermittent pain every time she's under the lights, and she describes that as a 6 out of 10. No other medical problems except for she's been complaining of just a very generalized fatigue and intermittent nausea and vomiting. However, she is a lawyer. She admits to working 80 to 100 hours a week and has 2 children. So she contributes her generalized fatigue to the fact that she's just busy. She's a busy woman with a tough schedule and trying to raise a family. She does have help from her husband and has a live-in nanny, so that relieves some of the pressure. However, this new generalized fatigue's only been in like the last 8 months. She can't really describe it, and this underlying intermittent nausea she can't describe as well. She's up to date on all of her vaccinations. She's a normal, well woman who is keeping track of her health care. As far as her family history goes, there's nothing significant of cancer. Her parents are both dead, but they died of natural means and, well, not natural, but CHF and diabetes in their late 70s and 80s. Like I mentioned, she is a lawyer, social history. She doesn't smoke, she doesn't drink, she's never done recreational drugs. She was raised Catholic, but hasn't really attended church and doesn't really have a spiritual connection at this time. Review of symptoms and my actual physical exam really did not reveal much. She denies chest pain. She denies shortness of breath. There's neurologically, everything's intact. The only thing that we found was this very generalized nondescript fatigue, intermittent nausea, and this dark spot on her nail. So that being said, my differential diagnosis for this patient, with her vital signs being perfect, with blood pressure of 115/65, heart rate sinus 65, no shortness of breath, rest rate 16, she's afebrile, she's within her normal BMI. All of her general appearance seems perfect. The only thing that was found on her differential diagnosis and her physical exam, on her physical exam, was this unexplained dark color under her fingernail. That being said, we have to start with a basic workup. We started with a CBC, a CMP, UA. She has a history of the thyroid issues. So we got a TSH, T3, T4, just to check on that. She is on Synthroid for that. We also got a lactate dehydrogenase. However, we need to understand that as far as laboratory values go for potentially diagnosing melanoma, there's not much that we're going to be able to order that's going to diagnose it. It's all very dependent on a biopsy. So that being said, we ordered a biopsy on the fingernail and ordered an oncology referral. Fortunately and unfortunately, I got to follow up with this case when she initially came in, and then I also got a follow-up 4 weeks later. She came back in for just general health maintenance. This patient had followed up with her primary physician, with her oncologist, had gotten a biopsy, and she was indeed diagnosed with melanoma. Unfortunately, she is stage 4. It is a metastatic melanoma that has probably been started 8 years ago and undiagnosed. She was unfortunately given a life expectancy of less than a year. They are doing chemotherapy and radiation, but it's just to extend her life a little bit. It's crazy to think we all knew that UV lights were harmful, and we all know that we shouldn't be in tanning beds, and that has been something that as a nation and as health professionals we've been aware of, but we have to take that same concept under evaluation when we're getting gel manicures, because it's a very high intense UV light that is focusing right on our nails and the skin right below our nails. And like I said, we're not actually doing an assessment of our skin underneath the nails because it's kind of secondary. However, that being said, this patient is literally going to die because of having perfect nails. She's gotten gel manicures bi-monthly for 10 plus years because she needed to professionally look good. And now she is going to die because of melanoma. So I thought this was an interesting case. I wanted to pass it along just more for the information of the health risks of gel manicures, and to give people a little bit of information to make them think about what they're doing to their bodies. So as far as maintenance for this patient, we're just going to do supportive care and follow up. And the best thing that we can do is spread the word about the dangers of the most basic things that we don't actually think about. Anyways, that's really about it. If you have any questions or concerns, I would love to talk to all of you about it. Good luck with the rest of our term. We're almost there. Bye, everybody.